there's a trial, I'm a PI of a trial that has been funded by IRC, and let me thank IRC for giving us the chance. And this trial is specifically, drawn just in order to, evaluate, to confirm the prevalence of the aromatase gene amplification. In the paper published in Nature Genetics, we find out that the amplification and also, gene mutation may occur in roughly 15–20% of the patients. And so we designed this trial just in order to have the primary tumor and also the tumor relapse, so the metastatic deposits that may occur, after 1, 2, 5, 10 years after the primary diagnosis. And we will, evaluate not only aromatase amplification and also, of course, ER mutation, but also we will apply, a targeted next-gen sequencing panel, just in order, including, most of the genes which are frequently mutated in the ER-positive breast cancer, just in order to evaluate the mechanisms, or the genomic mechanism of resistance for our patients. This series has been, diagnosed and treated at the European Institute of Oncology of Milan, but of course the grant is a multicentric study involving the University of Genoa, the Imperial College in London, the IFOM, and of course our lab in Yale. We think that we will be able to evaluate, to better define the prevalence, and also to, evaluate the prognostic significance of this alteration, because of course this series is a very well annotated series, and so we have data on the survival of these patients after the relapse, and so we will see whether the occurrence of some kind of, genomic profile will be associated with a specific prognostic impact on our patients. And also we will collect also, of course, predictive data. So we know that this patient has been treated by specific, endocrine treatments, and we will be establishing which kind of treatment is most effective, based on the specific genomic profile. They may have had chemotherapy, but most of the patients had received an exclusive endocrine therapy treatment. That is quite a specific type of treatment we give to our patients at the European Institute of Oncology from the very beginning, thanks to Aaron Goldish and his group. They were pioneering this kind of treatment. So most of the patients have been treated just by endocrine treatment, but of course chemotherapy is allowed. And we could use, of course this is quite a technicality, but we could use the chemotherapy setting just in order to stratify the result, to see whether chemotherapy is impacting according to a specific genomic signature.